Okay, guys, so today we will discuss conjunctivitis. What and its classification. The main general classification of conjunctivitis. What is conjunctivitis? As you may already know, conjunctivitis, as the itis in the end of the conjunctiva, indicates inflammation. So it is inflammation of the conjunctiva. Simple as that. Then we come to the classification. We classify conjunctivitis on three bases. On the basis of exudate, that is the discharge. On the basis of reaction, that is, it may be papillary reaction or it may be follicular reaction. And on the basis of etiology, it may be infective and non-infective. On the basis of exudate, we have four types. One is watery, then mucoid, then we have mucopurulent and purulent. Watery conjunctivitis, mucoid, mucopurulent, and purulent. On the basis of reaction, as we already discussed, we have follicular and papillary. Now, on the basis of etiology, there is either infective or non-infective. Now let's go a step further beyond. So in watery conjunctivitis, there are two types, and the main one, the major and the most important one, is viral conjunctivitis. Wherever you think of viral conjunctivitis, you must think of watery discharge. No pus, no mucus, nothing else, just watery. Mucoid conjunctivitis, this is the characteristic of vernal conjunctivitis and keratoconjunctivitis sicca. Keratoconjunctivitis sicca, as the name indicates, sicca, dry, so dry eye, and the other one is vernal keratoconjunctivitis. Vernal means related to spring. So this type of conjunctivitis is mostly prevalent in spring season. Now, in these two types, we have mucoid conjunctivitis, mucopurulent in mild bacterial or chlamydial, and purulent, as the name indicates, purulent pus forming, so it might be a severe acute bacterial reaction or gonorrheal. Now coming to the reaction, we have either follicular or papillary. Follicular conjunctivitis is further divided into three types: viral, chlamydial, and due to toxic medication. Viral, chlamydial, due to toxic medication. Viral conjunctivitis is caused by adenovirus, picornavirus, and herpes simplex virus. Chlamydia, as you already know, it causes trachoma and paratrachoma. And in toxic medication, epinephrine. Now comes the papillary one. Papillary conjunctivitis is mainly this type of conjunctivitis mainly have like it covers the four major types, the 4 to 5 major types. That's the allergic disorders. In allergic disorders, we have vernal conjunctivitis, hay fever conjunctivitis, and atopic conjunctivitis. Then we have autoimmune disorders such as Stevens-Johnson syndrome, which causes papillary conjunctivitis, and we have chronic irritation due to use of contact lenses, prosthesis, or some sutures like nylon. They also cause contact chronic irritation. Then we have the fourth one is chronic blepharitis, that is squamous blepharitis, and topical medications such as atropine. These 5 types form papillary conjunctivitis. There are papilla, and in follicular type there are follicles. And in the future, I will make a video to differentiate between papillary and follicular conjunctivitis. So make sure to subscribe to our channel. Now coming further, the third classification is on the basis of etiology. It might be either infective or non-infective. Now, infective conjunctivitis, as the name indicates, it may be either bacterial, viral, fungal, or chlamydial. Non-infective, on the other side, it may be autoimmune, chronic irritation, allergic, chemical, and toxic. And with this, our classification is done. Thank you so much for your time.